Hi there, I'm Dr. Leslie Masters from Masters MD. Today we're going to talk about a big way that the face ages, and that's lines and wrinkles. You know, we think about lines and wrinkles, and a lot of people think that's it. If you've got lines and wrinkles, you're hitting old age. If the smile lines go away when I quit smiling, then I'm still young. You know, for women, it's a lot harder than it is for men. For men, lines and wrinkles add a little distinction, a little credibility, a little something other. Women, we want it smooth. Smooth as a baby's bottom. Lines and wrinkles are definitely a no-no. You know, I talk to people often about lines and wrinkles, and I tell them over and over again, I am convinced it's skin type and genetics more than anything else. Sun exposure, smoking, riding on the back of a motorcycle, all those things play a role in the way that our face ages, but I think it's tiny. Most of this is just the skin God gave you. It's luck of the draw. I will see 40-year-olds that are just wrinkled to beat the band, and then I'll see a 70-year-old that hardly has a line. That's luck of the draw. We do a whole slew of things for lines and wrinkles. It depends on what's causing that line. Is this an expression line made from muscle contraction in our normal everyday expressions? Is this from loss of elasticity? The skin is just getting old, doesn't snap back the way it used to. Is this from loss of volume and everything sort of hangs differently than it used to? It depends on what's causing the line will determine how we fix it. We've talked in other videos about volume loss. We've talked about loss of elasticity. I want to talk about a couple things when we're talking about lines and wrinkles though. Expression lines, the ones that make the scowl, make the smile. Those are lines that are driven by muscle contraction. Those are the lines that respond to Botox. Botox, think of this, rule of thumb, from here up. You shouldn't use Botox around the mouth. There are people that do, but it's not a good idea. You need to move your mouth to talk, to smile, to eat, to chew, everything else. Botox is from here up, and it'll soften lines and wrinkles that are caused by expression. Whether it's a scowl, or the raise of an eyebrow, or a great big smile, Botox can help soften those lines. Now, Botox is the second most tested drug ever on the market, next to the birth control pill. It's a safe thing to use. I get asked that all the time. Oh, Botox makes me nervous. It's a safe thing to use. What I want people to remember, though, is Botox isn't a fix. Botox is more like a Band-Aid. I can make it look better for a period of time, but I'm doing nothing to repair that line or to repair that skin. On the other hand, a new machine that's brand new out, again, we're the only ones in the state thus far to have this machine, is a machine by a company called Venus Concepts. So the name of the machine is Venus Viva. The medical terminology for Venus Viva is it's a nanofractionated machine. I'll put that in English. It's a little head that's got a radio frequency and infrared running through it. On the end of that little head of the machine are 160 microscopic needles. Now these are microscopic, you can't see them. I can put it into my face and I don't feel them. I walk across your face with this little head and it runs a radio frequency through the skin. That radio frequency does something different than the typical radio frequency machines out there or the laser. Instead of stimulating your existing collagen to tighten up again, this little injury caused by these microscopic needles will stimulate your skin to lay down new collagen. You ever see the little boy that flips over his handlebars and skins his chin and skins his nose? 2 weeks later, it's gone. Not a scar, not a mark, nothing to it. Kids' skin is rich in embryonic collagen. What we're doing with this new nanofractionated treatment is we're teaching adult skin to lay down embryonic collagen. If we can get you to lay down new collagen, we can fix things such as deep lines and wrinkles, the kind you get around the mouths, the kind you get from deep smile lines or the big comma smiles that a lot of people can have. Laying down new embryonic collagen will fix acne scars. It'll fix stretch marks. It'll fix deep lines and wrinkles. Any abnormal texture to the skin, including large pores, even that little bit of an orange peel texture some people can get from large pores over time. The Venus Viva is really an amazing machine. It's our newest machine. It's quickly become my favorite. I've used it on patients from 16 years old for little acne scars and blemishes to people for 76 years old, and we're treating deeper lines and wrinkles. It's an amazing machine. The thing that makes this machine even neater is this. Typically when we have a scar, when we have a line or wrinkle or something that's from chronic use, we will get a little color change from that. That color changes from vessels. It's kind of a pink. If you've got a blemish and it goes away, the blemish is gone, but it leaves me a pink spot. The Venus Viva will coagulate those vessels and make the pinks go away. It's the perfect treatment for acne, for rosacea, for acne scars, for deeper lines and wrinkles. I hope you'll come in and learn more about this and all the other things that we have to offer.
I had a scar that I've been it's bugged me for my entire adult life. I had an incident where I cut my lip open and the scar kind of went up and turned. And as I'm getting older, I've noticed that the scarring tissue is making its way to the surface and it was becoming more prominent. Probably I'm the only one who noticed it, but I noticed it and I didn't like it. Dr. Masters has a machine that's called the Viva, and she did 2 treatments on me. It's 1,000 little needles that basically go in and resurface the skin. I went ahead and I had her go ahead and do my entire face instead of just right in here, but that scar is gone. I can see it if I really push on it, but she gave me 2 treatments and the scar is gone. So, and it's also helped with my, just as we age, we get the little smoker lines, and I'm not a smoker, but I was starting to get them. And that has helped with those as well. It was great. I was here for maybe 45 minutes and was on my way. For about 4 days, I looked like I had a sunburn, but my age spots, I had an age spot here and I had a nice little age spot there. That's gone. I had some scarring from just maybe some blemishes. That's gone all along here. Those are gone. I've noticed also that it helped in a little bit of wrinkling around here and my forehead as well. It just made my entire skin, and it's even softer. It was wonderful. I would recommend it to everyone my age or actually younger. The younger you start, the better, in my opinion. I was a little bit timid on coming in to do anything to myself because I don't feel like I'm a vain person, but I did this for myself, and I am excited that I did it. I wouldn't change anything that I've done, and I would encourage anyone who's even thinking about it, just at least come in and talk to her. And because I have a feeling that if you have something that you want to get fixed, I'm sure Dr. Masters can do it. She's done a lot for me, and she's a very good person, and I would recommend her to everyone, and I do.